Interoperability takes many forms. HIMSS has defined 3 tiers of interoperability. First, foundational interoperability, which is the exchange of data from one HIT system to another without the requirement of the receiving HIT system to interpret the data. Second, structural interoperability, which governs the structure of the format of data exchange as a standard, most notable HL7. Third, semantic interoperability, which in contrast to tiers 1 and 2, focuses on the content of the messages that are exchanged between HIT systems, not just the format. In this way, the data can be interpreted and received in the native language of the receiving HIT system. What does this look like in the real world? A hospital organization's EHR can be connected to multiple data sources. With this foundational and structural interoperability, data can be shared, but it cannot always be easily interpreted by EHRs and clinicians receiving the data. This foundational interoperability does represent progress for health information exchange, but it can still create confusion, extra work, and potentially reduce clinical outcomes for clinicians and care coordinators. In this scenario, there is a requirement placed on the clinician that works in the receiving EHR to decipher the data in the documents received, interpret that data, and then make a decision about what data is not present in their own EHR. Then, the clinician must take action to transition the new data into their EHR, either as a static document placed into the patient record or by updating portions of the patient record with information received through the interoperability solution. With semantic interoperability, however, the interpretation of the data within the documents is done for the clinician. Semantic interoperability allows patient data such as clinical visits, medication history, allergies, patient notes, and lab results to be communicated to the receiving EHR in its own native language, and as discrete data presented at the point of care. The only requirement of the clinician is to review the data and determine which pieces they want to bring into the patient chart, effectively harmonizing clinical data from multiple sources in multiple languages intelligently across systems. Semantic interoperability supports clinical decision-making and enables clinicians with the actionable information they need when they need it. This drives time savings by eliminating redundant searches of static documentation. It drives down costs by preventing duplicative testing and reducing readmissions. And clinician satisfaction is heightened by simply removing work effort and frustration and enabling them to focus on delivering patient care.